Hello everyone, my name is Dr. Tien Ho, and today I will be presenting my quality improvement project titled Applying the Improv Score to Reduce Readmissions from Post-Hospital Venous Thromboembolism Development. Hospitalization is one of the highest risk factors for acquiring venous thromboembolisms, which include both deep vein thrombosis and pulmonary embolisms. Alarmingly, 2 out of every 3 newly diagnosed VTEs occur within 30 to 60 days after hospital discharge. The prevalence is perhaps greater as asymptomatic VTEs are often not recognized nor treated, leading to increased morbidity and mortality. Financially, medical institutions are being scrutinized for every 30-day hospital readmission and penalized with reductions in insurance reimbursements. Finding an algorithm to identify patients who are at risk for developing VTEs after hospital discharge could benefit both patients and the medical institution. The objective of this study is to evaluate the incidence of readmissions with VTE diagnosis and apply the improv risk score to assess for potential preventive measures. Methods. This was a single-center retrospective cohort study conducted at a 430-bed community hospital from January 2020 through December 2021. Using our electronic medical records, we screened for a patient population who was readmitted with a new primary or secondary VTE diagnosis within 30 days or 60 days post-hospital discharge. For each patient, we applied the improv risk score, which gave quantitative data to help determine risk for VTE development prior to hospital discharge. Below is the improv risk score. The score is an accumulation of multiple factors, such as if they have had a previous VTE, a previously known thrombophilia, for example, factor V Leiden or antiphospholipid syndrome, if they have lower limb paralysis, current cancer, and if they stayed in the intensive care unit or cardiac care unit during their index admission. Also, if they are more than 60 years old, and if they were immobilized for 7 days or more, which can include bed rest immediately prior to and during hospitalization, or having a hospital length of stay of at least 7 days. The scores would then be categorized as shown below. Results. 348 patients met the inclusion criteria for readmission with a primary or secondary VTE diagnosis. Of these patients, 85.1% were readmitted within 30 days and 14.9% were readmitted within 60 days. The average age for day 30 and day 60 were 60.3 and 59.6 respectively. Of the 348 patients, 61.5% were found to have a deep vein thrombosis and 68% were found to have a pulmonary embolism. 27.6% were categorized as high risk, 16.1% were moderate risk, and 56.3% were low risk. The following graph shows that there were much more patients in the low risk group compared to moderate or higher risk group. Patients who subsequently died after readmission include 4 from the high risk group, 6 from moderate risk, and 6 from low risk group. Of those that were tested for SARS-CoV infection, 1.7 were in the high risk group, 2.6% were in the moderate risk, and 6.6 were with low risk. Discussion. Early identification of patients at risk for VTE development upon discharge may prevent readmission and subsequent negative medical and financial outcomes. One of the benefits of this study is that not only contributes to data of previous trials, but uniquely this data was derived from the community hospital perspective. Moreover, this study was conducted during the SARS-CoV-2 pandemic, which in itself is a prothrombic illness. Overall, we have provided evidence that even patients who have low improv risk scores can develop VTEs, and if this algorithm were to be used in a hospital setting, providers will have to use their judgment on when and how to intervene. But not recognizing this concern at all will continue to be detrimental to both patients and the hospital. In this study, we show that the improv risk score can objectively stratify patients who are at risk for VTEs on discharge, and that it can be applied in the community hospital setting. Recently, the improv risk score has been modified to now incorporate the D-dimer lab, which previous trials have deemed it more accurate than the initial improv score. Future QI projects should focus on analyzing both the improv and the modified improv risk score from a community hospital perspective and perform cost analysis with adding the D-dimer lab. Thank you for having me, and thank you so much for your time. I've left my contact information below, and please do reach out if you have any questions or concerns.